gonna do is in the room. Okay. Got my desk. Binders here, nothing on it. 2 cups. Bedside table. Got the bed. Okay. Nothing on the walls. Nothing on the floor. Got my med room desk here. Drug handbook, MAR. Okay. Before we start, I'm going to start in the med room. I'm going to perform the proper hand hygiene. Hand sanitizer. Palm of the hands. Back side of the hands. Infant fingers. Cuticles. Once the hands are dry, I'm going to sign into the EHR. Okay. I'm going to check if Mr. McDougall has any outstanding orders from the physician for medication. Upon reading the EHR, it says that he has an order for 0.25 milligrams of digoxin, PO daily, administered at 0800. Okay, so now I'm going to go into the MAR. I'm going to check Mr. McDougall's past medical history and allergies. Upon reading the MAR, it states that he has an allergy to penicillin and sulfa. Next, I'm going to go into the drug handbook. I'm going to go to the digoxin page, and I'm going to check for the drug interactions or contradictions. Upon reading the drug handbook, Mr. McDougall will not experience any of the drug-to-drug interactions with his current or prior medications, and he will not experience any contradictions with his current or prior conditions. Therefore, the medication is compatible for this patient. Okay, so now I'm going to go back into the EHR. I'm going to check the dosage once again of the order. The order says that he is prescribed 0.25 milligrams of digoxin. Available in the cabinet, we have 0.125 of digoxin. Therefore, we're going to use 2 tablets. I'm going to put 2 tablets into the computer, and I'm going to hit remove. Once I hit remove, drug cabinet will open. Okay, take the drug out of the cabinet. Now I'm going to read the backside label and see the expiration date. The expiration date reads August 2021. Therefore, the medication is not expired and is valid. At this point, I'm going to check that this is the correct medication for the first time. I'm going to check the EHR again. I'm going to check the drug handbook and the MAR. Okay, once I confirm the medication, I'm going to place it into a cup. Also going to take a second cup, and I'm going to fill it with water for the patient. Okay, now I'm going to do my second check of the medication. I'm going to check the EHR, I'm going to check the MAR, and I'm going to check the handbook once again to confirm for the second time that this is the correct medication. Now I'm going to note the 5 rights of medical administration. The 5 rights are the right patient, the right medication, the right dosage, the right route, and the right time. Okay, so now, before entering the room, since the patient is in reverse isolation, I'm going to don the proper PPE, put on a mask, gown, gloves. I'm going to enter the room. Okay. Place the medication down on the table, bedside table. Good morning, Mr. McDougall. My name is Nurse Kenneth. I will be assisting you with your medication today. We're going to start by you telling me your first and last name and your date of birth. While he tells me the information, I'm going to check the bracelet on his wrist to check if the information given is matching up with his bracelet. Okay, very good. Now, Mr. McDougall, do you have any allergies to medication? Mr. McDougall states that he has an allergy to penicillin and sulfa. Okay, now I'm going to close the curtain, right? While I close the curtain, I'm going to make sure I do not lose sight of the medication. I'm going to keep the medication in my sight at all times for safety reasons. Okay, Mr. McDougall, now I'm going to just scan your barcode on your wrist in order to verify your identification once again. Very good. And now I'm going to do a third check of the medication to make sure it is the correct medication for the third time. I'm going to check the EHR on the rolling car computer. I'm going to check the MAR once again, and I'm going to confirm for the third time that this is the correct medication. Okay, Mr. McDougall, now I'm going to explain you the procedure and the side effects of this medication. So what I'm going to give you is 2 tablets of digoxin. Digoxin is used to treat mild to moderate heart failure. Now, you may or may not experience some adverse effects of this medication. These effects include depression, headache, vomiting, and diarrhea. If you experience any of these adverse effects, please let me or a nearby nurse know. If there are no nurses around, you have your call bell. You can ring your call bell and we will be right at your bedside. Okay, now before we do anything else, I'm going to check your apical pulse. Very good. Okay, now I'm going to raise your bedside to a comfortable position to help you intake the medicine. Okay, before I administer the medication, I'm just going to let you know of your 5 rights of medication. Okay, so you're going to have your right education, your right assessment, your right evaluation, your right documentation, and your right to refuse. Okay, so now I'm going to administer the medication. Okay, like I said before, you have 2 tablets of digoxin, and we got some water in this cup. Okay, you're going to make sure that you swallow the tablets entirely. All right, here you go. While he's taking his medication, I'm going to make sure that he completely swallows both tablets and he's not hiding any of the tablets on the sides of his mouth, the back of his throat, or his tongue. Okay? Very good. Now, Mr. McDougall, is there anything else I can help you with to make you comfortable? Like I said previously, if there's anything that's bothering you, let me or any nearby nurse know. If no one is available, you have your call bell. You can ring your call bell and we'll be there momentarily. Okay? I will check up on you in 30 minutes just to make sure you are okay, regardless. Okay? Before leaving the room, I'm going to take off the PPE and dispose of it in the correct basket. And I'm going to perform hand hygiene and I'm going to exit the room.